Every house requires a solid foundation. Similarly, every complex movement pattern also requires a solid foundation. For example, getting on and off the floor, walking, going up and down stairs, stepping over obstacles, all the things that I would consider complex movement patterns. And building that foundation that leads to those complex movements, in my opinion, should involve what we call developmental activities. And developmental activities can include movements where you're laying on your stomach, or you're in the quadruped position, which is on all fours, on your hands and knees. You're in the kneeling position or the half kneeling position. And herein lies the problem. If you have a history of knee pain, these positions can be extremely challenging, and in most cases, most people just throw in the towel and just say that they will find a different route in getting to those complex movements without using any of those positions that I just mentioned. But I don't think you should be so quick to throw in the towel. If you watched last week's video, I started a series where I was talking about knee pain and some of the things that can cause knee pain. In that video, I really focused on arthritis. And the reason I focused on arthritis is because it is the #1 reason that people tell me that they cannot get into all of those positions I just mentioned, is because somewhere along the line they have been diagnosed with arthritis and they believe that that is the cause of their knee pain, and thus they can't get into those positions, which really does kind of cut off a whole kind of bedroom in the house of activities that are so valuable when it comes to restoring normal movement patterns after a stroke or a brain injury or any kind of damage to your neurologic system. And I don't think it's necessary. I think there is a lot of potential for those of you who can't currently get into those positions to eventually be able to get into those positions by using a step-by-step progression. Now, the first step is understanding what is causing your knee pain and really getting to that root cause and addressing the underlying root cause problem will in turn lead to your ability to get into these positions and open up a whole new world of activities that you're not only going to enjoy, and it's going to add variety to your rehab program, but it really is a critical component to restoring these movements. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, mindset, in the context of those of you who have had damage to your neurologic system, with the end goal of empowering you with as many tools as possible to reach your highest maximal level, be able to move with less pain, to have greater independence, and just feel more in control of your rehab program. And all of that being said, as I mentioned, this really is a second video in a series that I started last week. Just to reiterate, in last week's video, I focused primarily on arthritis because it really is the #1 reason that people tell me as to why they can't do certain activities. Either they self-diagnosed or they've been diagnosed by a doctor that they have arthritis, and they have made the connection that the pain in their knees is associated with that diagnosis. And I also kind of mentioned in that video that just because you've been diagnosed with severe osteoarthritis does not necessarily mean surgery is the only option. And just a fun fact, when I was diving down my rabbit hole of doing a little bit of research for this series, I came across a study that looked at types of doctors that diagnose knee arthritis, and I will link this study below, but in this study, they just happened to mention that orthopedic surgeons have a tendency to rate the severity of knee arthritis a little bit higher. So just food for thought if you have been diagnosed with severe arthritis by an orthopedic surgeon. There's a little bit of data out there that might suggest that it might not be severe arthritis. And along those same lines, surgery is only indicated if you are at end stage, meaning you have severe arthritis. And when I say surgery, I'm referring to total knee replacements. I will get into the video really quickly, but just one quick fact, just on my own personal experience. I also mentioned in last week's video that I do spend some time, I used to spend a lot more time, now a far less time in the hospital. I would go in the evenings as I was kind of building my business, and I would primarily be on the orthopedic floor where I would see people right after surgery. And I kind of cherry picked the study because it confirmed some of my skepticism based on what I would hear from patients as they were coming up onto the floor after surgery. Usually the way the process works is when they're in recovery, the doctor will come and meet with them and just kind of go over how the surgery went. And I would say, I don't have the exact number on this, but I would say 70% of the time, as patients come up onto the floor and were kind of giving me the debrief of their surgery, 70% of the time they would tell me, the surgeon told me this was the worst case of arthritis he's ever seen. It was bone on bone, and he does not even know how I was walking. And when you hear patient after patient after patient tell you that same exact thing, it makes you start to wonder just a little bit. But that is not the purpose of this video. The purpose of this video is to really help you drill down to what that root cause is. So I'm going to first go over what are some of the causes or things that if you had arthritis in your knee, that where you might feel that arthritis a little bit more or where it might be a little bit more painful. A couple positions that I know if you have some breakdown in the cartilage in your knee. Again, I just did an entire video in depth on what knee arthritis is, so I will link that video below. But some of the positions, if you are having that articular cartilage wear down a little bit. Some of the movements that might be painful is bending the knee in a what we call a closed kinetic chain position. And I'll put a link for a video I just did on closed kinetic chain activities in the lower extremity because that'll help you understand that. But when the foot is planted on the ground and you bend that knee, that's usually a little bit painful if you have arthritis in your knee. Again, watch last week's video. Arthritis does not necessarily mean it is painful. You can definitely have some wearing down of the cartilage and have zero pain at all. So that is definitely the purpose of this video, because I'm going to give you all the other reasons as to why you might be having pain. So definitely make sure you stay to the end of this video. But if you do have painful arthritis in your knee, you might also have pain when you're going up and down stairs. Sitting down or standing up from a chair might be painful if you have arthritis. And in advanced stages, loading the leg could be painful and could be the result of some breakdown in that cartilage. So basically just putting your full body weight on that leg. And again, in last week's video, I hopefully opened your eyes up to some of the things that are in your control, especially if you don't want to have surgery or maybe you're not a candidate for surgery, of things you can do to decrease the amount of pain that you have related to arthritis. So definitely watch last week's video. Now, I know it took me a long time to get here, but the main purpose of this video is to talk about all the other things that could be causing your pain that might not be arthritis. So things that might cause knee pain but maybe are not related to the diagnosis you received of knee arthritis. I don't think that getting on your knees into a tall kneeling position would be painful as a result of painful knee arthritis or breakdown in that cartilage. Bending the knee in an open chain position, meaning that if you were laying on your stomach and bending the knee, just rolling in bed, laying on your stomach in general, swinging the leg through when you're walking. So not when your leg is on the ground, but when your leg is in the air, if you have knee pain, I do not think that's a result of knee arthritis. And lifting the leg up to get in and out of a car, if you have pain in your knee with that skill, I do not think that is a result of knee arthritis. So if any of those things are causing your pain, I don't think it's accurate really to trace those back to knee arthritis. And that's a good thing, because all of the things I just mentioned are what I believe a result of the damage to your neurologic system. And I do believe there are progressions of activities that you can do to move with less pain. And that's what we're gonna go over next. But one last thing before I move on to that is something I mentioned in last week's video, but I really want to reiterate this. If you did not have pain before you had damage to your neurologic system. You did not have knee pain. And maybe you're in the first year or two after your stroke or your brain injury or your MS exacerbation, maybe a prolonged hospitalization, and all of a sudden you have severe pain, and maybe you did go to an orthopedic doctor and he kind of put your complaints of pain and the diagnostic imaging that he did together, and he believes that your pain is a result of your severe arthritis that might have shown up on an image. It could be, but I also have a hard time believing that in that short amount of time you could go from having no pain to having severe painful arthritis in your knees. So just something to keep in mind, and that's what's going to make this next section of this video important, is now we're going to go into what could be causing your pain if it's not due to severe arthritis. The root cause probably goes back to either spasticity or abnormal synergy patterns, or both, and in most cases both. So spasticity is an involuntary contraction that is a symptom of damage to the brain or the spinal cord. An abnormal synergy pattern is where groups of muscles link up abnormally and you get these gross patterns. In this case, I would say it's an extensor synergy pattern, and it is that abnormal linking of muscles, in this case an extensor synergy pattern, where every time you want to extend the hip, the knee wants to lock out and the foot wants to point. So how do spasticity and abnormal synergy patterns cause knee pain? Well, spasticity in the quads, so those are the muscles that straighten the knee, they have a tendency to kick in at the most less than ideal times. So if you're going to get onto your knees and your knee is trying to straighten out, but it can't because you are on your knees, in most cases it would be painful on the front of the knee. Now remember, when you're in that tall kneeling position, your hip is extended, which that leads to the abnormal synergy patterns. Remember, when the hip extends, the knee wants to extend and the foot wants to point all at the same time. That is an abnormal linking up of muscles that is the result of damage to the brain. When that happens, you're extending your hip, but your knee can't straighten out because you're on your knees. And again, you'll feel that. You'll feel that quadricep trying to pull that leg straight and it just can't do it, and that could also cause some pain in your knee. Now, these spasticity and abnormal synergy patterns could potentially also make the swing phase of walking difficult and maybe cause pain in the knee because your knee or your leg is trying to bend to clear the ground when you're swinging the leg through. If you have spasticity in your quads, meaning the leg is involuntarily trying to extend, or you have an abnormal synergy pattern into extension, meaning the knee is just going to involuntarily extend, either one of those would be problematic through the swinging phase of walking. Primarily at the very, very early stage when your foot is somewhat still in contact with the ground, you're trying to swing that leg through, the knee is not bending, and it's kind of like you're coming up against the force of the ground. That could potentially cause some pain in your knee. Lifting the leg to get in and out of a car, if your leg is locked out in extension, which a lot of times does happen because that abnormal synergy pattern a lot of times kicks in when you are trying to get that leg in and out of a car. So that leg stiffens up, that knee locks out, you're trying to bend it, or if a caregiver's trying to bend it, so they're forcing it, you guys are in a rush, they're just pushing it and trying to bend it, that could make your knee hurt. Maybe not necessarily related to arthritis, maybe just the fact that you can't get those quads to relax, and so that could be painful. There's a lot of resistance, quads are kicking in, trying to keep that knee straight, and either you or someone else is trying to bend it. That could also be painful. Rolling from your back to your stomach could also trigger an extensor synergy pattern in the leg, and potentially not something I commonly hear people complain about, but I have heard people tell me that their arthritis makes their knee hurt. That's why they can't lay on their stomach. So that could potentially be one of the reasons is that that leg stiffens up, and that could be why you're having knee pain with that movement. Again, I don't think it's related to knee arthritis. Now, not related to this video, but something that I think is just important to reiterate, and I've said it in other videos as well, that knee hyperextension over a prolonged period of time, so knee recurvatum, letting your knee do that over and over and over again when you're walking, I do think can cause the knee structures, the cartilage specifically, to break down at a little bit of a faster rate. But again, remember, in last week's video, I talked about the number of cases of people that I've seen with arthritis over the years that have zero pain. So that goes back to that idea of inflammation. I do think we have a little bit of control over that through diet, drinking water, things like that. So if you are starting to get some knee breakdown and you are kind of putting that together with your pain symptoms, please, please, please don't forget that there's still things that you can do way before surgery, so definitely check out that video. But if your knee is going into hyperextension, I highly recommend you get back into physical therapy and work on bracing and other methods to stop your knee from locking out, so to take as much of that abnormal stress off the knee joint as possible. And then the other thing that I can think of that speeds up arthritic changes in the uninvolved knee are compensatory strategies. So over time, just excessively putting more and more weight, step after step after step on your uninvolved leg, over time, that knee is just going to break down. So if you're in the early stages, please, please, please get back into physical therapy. Watch the videos I have on a walking progression where you just relearn how to center your body over your involved leg and build that confidence on your involved leg so that you don't have those arthritic changes in that other knee due to compensatory strategies. The other thing I recommend is if you're using a quad cane or a hemi walker, God forbid, I hate hemi walkers, but God forbid you're using a hemi walker, you are just further kind of leaning heavily on that hemi walker on your uninvolved side, putting a lot of stress on that knee. If possible, if you can get down to a lesser assistive device, you're not going to be as likely or as willing to want to spend so much time on that leg, and it might protect that knee for a little bit longer. So that's if you have pain in your uninvolved knee. Now, why do I bring all this up? If you can identify that you have knee pain and it might not be related to arthritis, but one of those other things I mentioned, there is a progression. So if you have pain when you're getting on your knees, and it could be because you have that abnormal synergy pattern, my suggestion is just work on bending that knee in other positions where you're not in that kneeling position. So the other ways that you can work on getting your brain and your body comfortable with bending your knee with your hip extended is to lay on a mat and just put some ankle weights around your ankle and just let your leg hang off the mat. Let it get used to bending with your hip straight. So we call this an out of synergy movement because your hip is straight and your knee is bent. Remember, an extensor synergy pattern, the hip is straight and the knee is straight. So this is a first step in getting into like an out of synergy movement. So the purpose of this exercise is to learn how to inhibit or make the quadriceps less active. So this is for anyone who their leg always tends to be stiff or lock out in extension. What we're doing on this one is we're actually locking the leg out. So I am kicking it out straight. And then I have an ankle weight on my ankle to help to bend the knee. What you want to think about after extending it is relaxing the leg. Again, we're trying to decrease that stiffness that you feel when you're walking. Some people will think of that as like their foot feels like it's getting stuck to the ground when they try and swing it through. Those are all signs that you might have an overactive quadricep muscle. So this is a good gait drill for anyone that has that stiff leg. So I'll show it to you again. You're just going to kick it out, and then the goal is to let it relax. So you're going to kick it out, and then you're trying to let that knee bend by relaxing that quadricep. Kick it out, and then let that knee bend by relaxing that quadricep. Kick it out, and then let that knee bend by relaxing that quadricep muscle. The other thing that I love is squatting. Just getting used to bending that knee again, letting those quads relax, super valuable. So if you can get some help or find a way to get into a squatting position. And yes, I do think for this particular position, laying down and just bending your knees, I don't think is as good as getting into that squatting position.
This tutorial, what we're doing is one of the good progression exercises in relearning how to get down to the floor, and that is getting down to a lower surface from a chair and being able to get back up. This is one technique in order to be able to get off the ground, but it's also good just to get closer to the ground, start feeling a little bit more comfortable being close to the ground in preparation for eventually being able to get all the way down to the ground. So I just have a step stool here. I like the step stool with a handle. They're a little bit sturdier than those ones that fold or those plastic ones. It's just a little bit heavier and it's not going to tip over as easily. And then I'm just in a standard height chair. If you have a weaker side, that's okay. What you're going to do is take your stronger leg and put it on the other side of the step stool, and your hand's going to stay on the chair, the support surface, and then you're just going to lower yourself down using your strong arm and your strong leg to lower yourself down, and then you're just going to try and push back up.
Now from this squatting position, what you can do is you can kind of rotate your body and start to get used to getting into that half kneeling position.
All right, so now you're in kind of a squatting position. And what you're going to do is you're going to take this leg, this is your stronger leg, and just kind of put it out in front of you a little bit. And then move this leg over a little bit. And then basically all you're doing is you're just going to side sitting on the stool. We're not going to go into half kneeling yet because that is a pretty advanced skill, but you're just going to go from squatting to kind of side sitting.
Half kneeling, where you're just kneeling on one knee, might be easier or more tolerable in the early stages. So maybe you work on getting into a half kneeling position before you get into the kneeling position. But the key bottom line is everything I mentioned is from an overactive quadricep, that leg just trying to straighten out involuntarily in the most unideal times, creating that pain. So anything you can do to work on knee bending. And then the other thing that I think, whether you have arthritis or some of these other things are causing your knee pain, is finding a way to just either pad the knee or offload the knee.
So I'm going to give you a couple of different variations that you can do to kind of minimize that pain and help you get into kneeling. One is these little pads. They're called Stick E, and basically they just Velcro to the front of your knees. I like to put the rounded side towards the knee. I'm not really sure if that's exactly how they go or if the other side's supposed to go, but that's just how I use them. And then what it does is it just kind of offloads the kneecap a little bit. And then it makes it a lot easier to kind of go down to that knee a little bit more comfortably, again, without having that pressure on your kneecap. And then if you don't have these or don't want to use these, the other option is just using a pad. So you can use one of these foam pads. If that's not enough, stack two of them on top of each other. This, I believe, was $10 on Amazon, but it's just what they call like a balance foam, and it's pretty squishy, and it might be enough to help you get down onto that knee. And again, same thing. You're just going to go down. It gives you a little bit more padding for your knee. If that's too painful, you can kind of use the same idea as with these and kind of try and drop your knee just a little bit off the front of it, just so that there's no pressure right directly on that kneecap. Some people, that's where they have that pain. So just something to keep in mind. You can drop it off the front and that might be a little bit more comfortable as well.
Those two things might help to make kneeling a more tolerable position. And now, what was the whole purpose of this two-part series to begin with? Everything in this series was motivated to be able to get more of you to be able to get into kneeling and half kneeling positions with less pain. So I hope there were some strategies that you found in this video that you can help to build up or work up to getting into those positions. And then that is it for this video. I hope you found this video helpful. If you have any questions or you have any suggestions for future videos, definitely leave those in the comments below. I enjoyed spending time with you all, and I will see you in the next video.